So today I'm talking about tattoos. Several of you have asked me about my thoughts about medical professionals and tattoos, so today I'm going to cover this topic both from a general and personal perspective. More specifically, I'm going to talk about whether or not doctors should have tattoos and whether or not tattoos have an impact on the doctor-patient relationship. But I'm also going to talk about my own tattoos, or at least the one with the most significance to me. I will share the story behind it and explain what it means to me. So first, the general perspective. Tattoos are a form of personal expression that have become more commonplace in the world and consequently the workplace as well. Data from Ipsos in 2019 suggests that in the US, 30% of people have at least one tattoo. The percentage increases for those under the age of 55, with 40% of those between the ages of 18 and 34 having at least one tattoo, and 36% of those between the age of 35 and 54 with at least one. So this is the general population. What about the medical profession? Does it reflect the trends that we see in the general population? If the medical population reflected the normal population, we would expect that 3 to 4 out of every 10 physicians would have a tattoo. However, the same Ipsos poll showed that individuals with a college degree were 7 to 10% less likely to have a tattoo than their similarly aged counterparts without a college degree. So it is likely that the percentage of physicians who have tattoos is slightly less than what we would see in the general population. In fact, more than 40% of doctors are reported to disapprove of tattoos in medical professionals and staff. But apart from the actual prevalence of tattoos in the medical population, there are a number of points to consider when contemplating the right or the wrong of tattoos. Some things to consider include the importance of traditional appearance and trust, the doctor-patient relationship, hospital policies, the location of the tattoos tattoo's content visually, and the message shown or implied by the tattoo. Traditionally, studies have shown that people prefer and trust those who appear like traditional doctors, with scrubs, lab coats, or business attire. These studies concluded that patients are more satisfied with these appearances because they associate them with professionalism and proper behavior both in and outside of the medical setting. But with the prevalence of tattoos increasing in the younger population, it is not surprising that these views may also be changing. In 2017, a study in the Emergency Medicine Journal observed the interactions of 7 emergency room physicians who treated 924 patients over 9 months. The physicians treated the patients while wearing fake piercings, stick-on tattoos, or neither of those. After 9 months, patients who were blinded to the purpose of the study were surveyed about their satisfaction with their treatment. They were also asked about the doctor's professionalism, competence, and reliability. Each doctor was also rated on approachability, empathy, and trustworthiness. The study revealed that patients did not perceive the doctors differently, whether they had or did not have tattoos or piercings. The doctors were also rated positively, regardless of tattoos or piercings. Frequently, patients did not even notice the tattoos or piercings. So while there is certainly a tradition of medicine, times are indeed changing. And with it, so too is the idea of what is acceptable in the medical workplace. Patients appear to trust those with tattoos and piercings just as they would a physician without them. Ultimately, as it should be, it is physician competency that patients are concerned with. When a patient seeks aid from a physician, both parties develop a doctor-patient relationship. This relationship is very important because it allows the patient to feel comfortable enough to share personal information with the physician when they are particularly vulnerable. This may be difficult to achieve if the patient has a negative or traditional attitude about tattoos. In the past, tattoos have been associated with socially unacceptable behavior. But today, especially with millennials, tattoos have become much more prevalent and widespread. In fact, some argue that patient-doctor dynamics are changing and that the tattoos may actually make the physician more human and more relatable to the patient, thereby improving the patient-doctor dynamic. But whatever the case, it is the interaction that is most important, and the tattoos or their message should not detract from or preempt the exchange of information between the patient and the physician. Right or wrong, we all have our own implicit biases. And if we can avoid adding additional barriers to the doctor-patient interaction, it is certainly favorable. Depending on the facility where the physician works, there may even be administrative policies in place to protect this interaction. Typically, these policies might cover placement of tattoos and their visibility. Frequently, they indicate that tattoos are to be covered during work hours, which leads to the topic of placement of tattoos. As it is not unusual for hospital policy to dictate that tattoos be covered during work hours, it is common for tattoos in medical professionals to be placed in areas that are not directly exposed during day-to-day interaction. Typical locations include the torso, the shoulders, the legs, and the insides of the upper arms. It would be very uncommon to see tattoos on the face, head, or neck, or tattoos on the hands. Even though tattoos are more acceptable today, there is still a stigma that is associated with tattoos in these locations. Additionally, policies may speak to the content and implied message of tattoos as well, especially if they are visible. A physician's role is to treat those who are in need of care, and for physicians to be effective, they must garner the trust of their patient. This may be difficult to achieve if the physician is displaying a message or an image that is overtly hostile or exclusionary in nature. While tattoos are a form of personal expression, it is a bit hard to convince a patient to trust you if your tattoo says something completely opposite. So what are my thoughts on tattoos? Well, I think that tattoos are generally acceptable if the issues discussed above are taken into consideration. I myself have several tattoos, and in the past, I have had several piercings as well. Personally, in a hospital setting, I prefer my tattoos to be easily covered so that I can decide when and where I think it is appropriate for them to be seen. And while people may be more accepting of tattoos than they once were, I have avoided the areas that are still stigmatized today. All of my tattoos have personal meaning, and neither the images nor the implied messages are exclusionary or derogatory in any way. My favorite tattoo has special meaning that I would like to share with you in an unscripted manner. My favorite tattoo is one that I have on my right shoulder, and this is a tattoo that, as I said, has special meaning to me. It combines a few of the things that are very important to me in my life. And so the story behind this tattoo is that while I was in my orthopedic program, we would always have these teaching sessions where we would spend one half day a week going over orthopedic cases and orthopedic principles as a group of residents, and we would test one another, or our mentor or preceptor would test us on these concepts that we were learning. So in 2006, that was the final year of my residency program, so I was one of the senior residents in the program, and we were on an academic half day. So this was a Wednesday, middle of the week. And I am one of 6 siblings. I have 4, at the time I had 4 brothers, and I had 1 sister. So 3 older brothers that lived in Jamaica, and then a younger brother and a younger sister that lived in Canada. And I got a phone call during the day from my mother. And my mother knew that during the day I would be busy with orthopedic things, orthopedic tasks or whatever. So she knew not to call me during the day because, you know, my attention would be drawn elsewhere. And so I got a call from my mother during the academic half session, and I thought I should answer this because, you know, my mother knows not to call me, and so this must be important. I stepped out of the academic half day, went into the hall, and I answered the phone. And when I answered the phone, my mother was distraught and she was crying. And so I knew right away that something was up. And as it turns out, my oldest brother, who was, you know, a relatively young man at that time. He was in his 40s. My oldest brother had died suddenly. And, you know, my brother was a young, healthy man. He was working, and he was in Jamaica. And through some poor decisions that he made, he ended up in a situation where he lost his life. And so this was very sudden, very unexpected. At the time that this happened, I was 6 weeks away from my final examination in orthopedics, what we call the quiz. So the quiz is our Royal College licensing exam in Canada, which is equivalent to the American boards. And in Canada, we do this exam at the end of our orthopedic training before we go out into practice, which is different than the United States, where you finish your residency, you practice for a couple of years, and then you write the boards. So we do the exam before we leave because we're not allowed to practice medicine or practice orthopedics until we pass that exam. So it was 6 weeks before my exam. I had been studying for 6 months for this exam. And then I got this call, my brother died. Needless to say, I had to drop everything that I was doing. I had to get on a flight to Jamaica to attend my brother's funeral. And because I was, although I'm sibling number 4, I was the only one of my siblings who had a university education, generally well-spoken and all that kind of stuff. So I was the one that had to oversee my brother's funeral and to speak at his funeral. The tattoo that I have incorporates that. Also, the tattoo that I have incorporates my profession, my chosen profession, orthopedics, because it is what I love. And I love my brother, and although he's not with us anymore, I loved him very dearly, and I wanted to commemorate his his life, and I always wanted to have some part of him that was with me. So I kind of thought long and hard about how I wanted to do that. And so ultimately, I decided to design a tattoo that showed my love for my brother and my love for my chosen profession. And so the tattoo that I have on my right shoulder is a heart, and the heart is broken. And the heart has my brother's name above it. And the heart, it's broken because my heart was broken by the death of my brother. But the heart is put together, it's stapled together, and it is plated together by orthopedic hardware. So the middle of the heart is stapled together with orthopedic staples, and the top of the heart is held together with orthopedic hardware, or, plate and screws. And to me, this was symbolic because although my brother had passed and I can't bring him back, his memory is going to live on through this tattoo in me. And I decided to devote myself to my career and try to do something that was constructive and that would allow me to represent my family in a positive way. Although my brother had made a poor choice that ended in his death, I wanted to try to counteract that with good choices and do something that I can give back to the world in a positive way and include him and make him a part of that. So I thought for a long time about that, and I spoke to an artist about the idea and the concept that I wanted to do, and I had the artist draw a couple of iterations of the tattoo, and then over time we finally selected one. I chose one that I thought represented very well. That's what we ended up with. And so that, as I said, is my most favorite tattoo, and it's the one that has the most significance to me. It's not the smallest one, it's not the biggest one, it's kind of in the middle, but it's the one that I like the most. And every time I think about it, it makes me smile, brings joy to my heart and a smile to my face. And it's something that I think is beautiful, and it doesn't bother me that it's something that I have as a physician. So, yeah, those are my thoughts about tattoos in the medical profession. Oh, hold on one second. The life of a physician never ends. I guess you want to see it. So there it is, right there. His name, staples, plates across the top. Ortho for life.